We've always had lots of interventions to try to help this or that, but peptides is allowing us to get really into how your body functions and to help it work in a natural way.
Dysautonomia is probably the most underdiagnosed, fixable or treatable entity you see in a chronic brain injury or chronic concussive patient. In the intervention, we do commonly use growth hormone releasing hormone peptides.
So a bioregulator is still technically a peptide, but it's an even tinier strain. So it's actually helping to regenerate the actual tissue or the organ based on which bioregulator you're using.
Discerning the correct remedy could be done symptomatically, but using the dark field is a very significant tool for what remedy to choose and what constellation of remedies. You could do more than one.
Computerized regulation thermography, or CRT, is really looking at the neurological connections from the skin to the spinal cord and back to the skin. So it's really a way of looking at how the nervous system is regulating.
It's not so much that if you react that the hyperbaric is the wrong thing, it's that your body isn't ready for it yet. The stimulation that the hyperbaric has on your mitochondria and your bone marrow and your immune cells, the hyperbaric just feels like too much for your body because it really does turn your immune system on.
The sleep medicine doctor looked at her the day before the sleep study was done and said, "I can tell by looking at you, you don't have sleep apnea." 48 hours later, severe obstructive sleep apnea. I think that probably a lot of Alzheimer's, a lot of age-related cognitive decline is actually undiagnosed, untreated sleep apnea.
What I'm going to be talking about is really flip on what parasites are. And I think when we're talking about the role of these organisms in really working towards this concept of immune tolerance, these are organisms that, at least with Hemenolepsis and many of these other ones, that don't actually harm us.
If somebody's wired under artificial lights all day long, they often have a hard time when they get home winding down at all. So these lenses actually can help sleep indirectly, but the main effects are twofold. One is physical protection from short wavelength blue light below around 450 nanometers, preventing physical damage to the eye, the retina, the macula, and so on.
So different blends will change the energy. Different intentions will change the energy. Somehow the master practitioner is able to navigate all of these variabilities to exhibit a healing response in the person. And this is what's so amazing.